Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, it's the third Friday of the month. That means it's time for The Doctor Is In, a Q&A with Ron Weiss, MD. You've got to send your questions in advance when we have any kind of a medical professional on, because it's only fair. And all you have to do is go to chefaj.com, sign up for my newsletter once a week. We just send you the schedule, and then you send that email back and say what the question is, who's it for, one question per email, short. We cannot read your complete medical history. If you want to consult, Dr. Weiss can do one, or if you live in the New Jersey or New York area, you can even see him in person. Please welcome back Dr. Ron Weiss. He's a doctor, he's a farmer, he's a doctor, he's a farmer.
Today, doctor. How is everyone?
Good. I don't know if people really know, because we haven't spent a lot of time talking about your farm, but I'm not sure everybody knows that you're also a regenerative farmer and that you live on a farm.
Yes. So, I spent a number of years doing all kinds of things. I was an emergency room attending in a very busy inner city emergency room for about, 6 years. I worked in a nursing home. I did all kinds of things. And then my last job before this as a doctor was, I had a sort of in the most densely populated area in the United States, which is in New Jersey, right outside Manhattan. I had a very busy clinic. It was everything. It was urgent care. It was primary care. It was multi-specialty. We delivered babies, just everything. It's like a little medical center. And so the people's diet in the area was so poor, and people had so many health problems that I decided that it was time to reinvent what I was doing, and that I could better help people by changing the food system instead of trying to change the healthcare system. And so that's what I got myself into. I exchanged that practice for a broken down old farm. It's like 300 years old. It's one of the most historic farms in America. It's been a working farm every day since its inception. And it was a mess when we got here. It was like, oh my God, just a mess. So we spent all this time regenerating it, getting chemicals off the land, it was growing all kinds of, oh my God, it was growing GMO, like Monsanto corn and soybean for, these animal concentration camps. All of that is gone. And now everything is organic and regenerative. And these foods in turn, they're the basis for feeding the community. And then the community gets better. So my practice is right in the middle of this farm. In order to get here, it's in an old farmhand's house. You have to drive past all the vegetables and all the beautiful things growing. So I hope that it sends people a message who come here.
It's such subliminal marketing, isn't it?
Yes.
Great. Well, it's funny because the first question is about vegetables. It's about raw vegetables. And I think this question from Carol is an excellent question, because I think it's part of a larger question, because I think a lot of people in the plant-based world only want their agenda pushed. So raw, vegan, SOS free. And so the bigger question is there one diet that's best for all humans, or are there variations? Because she wants to know, Dr. Weiss, are raw foods absolutely necessary? I've been whole food plant-based for a year, and my diet is excellent, except for the absence of raw veggies. I try to start out slow and add raw foods, but I always end up with stomach pain and bloating.
Well, that's an excellent question. I'm a believer that we need diversity in our diets. We need two kinds of diversity. We need many, many different kinds of plants from all of the areas, that's the sectors where we get plants from, whether they be vegetables, fruits, seeds and nuts, like starchy roots, whole grains, legumes, seaweed, mushrooms. Did I miss anything, Chef AJ? Those are all the plants in the world, right?
Pretty much. Herbs and spices.
Right. And mushrooms, which are not plants, they're related actually closer to us than they are plants, but it's okay. We let them pass. So the bottom line is, I believe in number one, all of those things. And the reason why is because they have so many different molecules, tens of thousands of different plant molecules, which we know are critical for our health. So you want to get all of them. And the more diverse the selection of plants is, the more diverse the feedstocks are for our gut microbiome. And I know we've had experts talking about the gut microbiome on your show, but the way I look at it is, when I first began in this world with my father, like 30 years ago when he had cancer, we gave him plants. I thought, oh, you know, the kale is killing his cancer cells. That's why he's getting better. It doesn't really happen like that. Yes, those plant molecules do help us overcome the diabetes and illnesses like that and cancer, but their direct path really is by influencing the bacteria in our gut to help us. So we know that the more diverse and the more different kinds of whole plant foods, and that's only whole plant foods, other kinds of like animal foods, refined oils or plant, they don't help our gut microbiome at all. You need those plant foods and a diverse numbers of them. You will create diversity in your gut microbiome because there are different kinds of bacteria that like to eat different things down there. And the more diverse your gut microbiome, the more resilient your immune system will be, the better you will be able to fend off diseases. So that's step number one to diversity in the diet. And step number two is, it's important to eat raw and cooked foods because I'll give you an example. We talked about kale, right? So eating raw cruciferous greens, like leafy greens, like kale, we hear it all the time, like from Dr. Esselstyn and just how Dr. Furman. These are amazing, amazing, some of the highest plant foods you can possibly eat, especially when they are raw. You know, we talked about our farm here before. That is our specialty. We are the greens, the kale and the leafy greens. We are well known throughout the state for having the best greens that anyone grows. Although, yes, we grow 80 different kinds of produce, 80, because we're a diversified farm. Those greens, we are champions. So when you eat the raw kale, it has phenomenal amounts of nutrients in it. Probably amongst the most nutrient dense foods you can eat. What happens when you cook it? A lot of those nutrients are diminished. However, some of them may be increased. For example, people who have macular degeneration, okay, are missing or don't have access to some very important plant pigments that help the macula, the very sensitive area of the eye that focuses and gives sharp resolution. They're missing this. Guess what happens to have the highest concentrations in the world of one of these pigments? It's not raw kale, it is cooked kale. So I say, yes, I'll have some of my kale raw and I'll have some of them cooked. Beets, for example, you know, you can eat raw beets, but if you steam the beets, you will get double the amount of capacity for the beets, and they'll be champions of all foods in the world to bind cancer-promoting bile acids in our gut. These are the molecules that we produce, are like detergents from bile that break up fats. But when they get down into our lower intestine, our microbiome, unfortunately, can alter some of them, and then they become like cancer-causing substances, and they can be reabsorbed through our intestinal wall and then be circulating in us. Steamed beets bind those cancer potential bile acids twice as much as raw beets. That's amazing. So those are just two examples of how cooked versions, and I could go on and on. Cooked tomatoes are well known to have many times the lycopene, which is a really important phytonutrient, than do raw tomatoes. Suffice it to say, cooked and raw. So what happens if you're having problems with raw vegetables? If you have a intolerance to them, it probably signals that, this doesn't sound like, in this young woman who's asking the question, it doesn't sound like it's a single food, right? Chef AJ, it sounds like she's saying just raw vegetables. I think that you may have a microbiome probably imbalance in your gut. And then I think by offering, going very slowly and going one at a time and introducing in graduated amounts progressively these foods back into your diet, but it has to be very, very gradual. I think that you can overcome these sorts of bothersome symptoms. Here's some other suggestions I often tell the patients who don't seem to tolerate like raw vegetables. And by the way, this process that I just described, this very gradual reintroduction, I just laid my eyes on this amazing new book that Dr. Bolshevich came out with. It's a recipe book, but it describes this process of if you have food intolerances, of going very slowly and reintroducing food so you can tolerate them. And this is his area of expertise, right? He's a GI doctor. He sees people all the time who can't tolerate certain foods. And he describes how successful this process is I just described. So you can do it too and get his book. It's the new Fiber Fueled Cookbook. And so, that's what I would do. There are a couple of other things, other suggestions I have. I have often found that introducing very resistant starches in the form of kodo millet and sorghum, because they're some of the most resistant starches. In other words, their starches don't break down in the upper intestine until you get to the colon. And so there's a lot of fuel in that starch and fertilizer for the good gut microbiome to regenerate itself. So we have had luck with that too, that those cooked grains can help overcome and help remodel your gut microbiome.
Well, that's good to know, because everybody loves grains. Grains are delicious.
They are. The staff of life.
Wow.
Right?
Do you think, like in a case like her, like it might help if she did a combination of maybe, like, instead of trying to eat a lot of raw vegetables, eat her steamed vegetables, but have a small amount of raw in with the steam?
Absolutely, and that's what I would suggest. And that because if you do that a little bit every day, and just pick one vegetable for now. Don't pick multiple representations of raw vegetables. Just take one and increase it slowly every week. And I think that you should be able to triumph eventually. Always remember, this is an aside, for people eating cooked cruciferous vegetables, whether they are broccoli, turnips, rutabagas, kale, cauliflower, it goes on and on, mustard greens, watercress. If you eat these things cooked, that you should take that little sample of the either broccoli floret, mustard seeds, a radish, because the cooked versions or frozen versions have been heated, and the essential catalyst to give you that great cancer fighting abilities of cruciferous is lost. Without that catalyst, you're wasting your time. Well, not wasting your time, but you're not accessing its most powerful cancer preventative and treating agent. So take a little raw leaf, one leaf, even for this lady, just one leaf or one little broccoli floret, chew it up very well so you can get the catalyst, and then you can get all the cancer fighting abilities from the cooked cruciferous vegetables.
Great. Thank you, Dr. Weiss. Wonderful. Okay, here is a very specific question on a medical condition. This is from, can't tell, Adana. Okay, she wants to know, are there any published studies showing reversal or improvement of myelodysplastic, myeloproliferative neoplasm with ring sideroblasts and thrombosis, using lifestyle intervention that she can share with her 79-year-old mother, because the doctors in Kaiser say whole food plant-based diet's only for to lose weight, and that there's no specific foods she should eat or avoid except to watch her salt intake.
Okay, whew. Well, first of all, we're going to have to go back to that name.
Okay.
Myelodysplastic, I got that one.
Okay. Myelodysplastic, myeloproliferative neoplasm with ring sideroblasts and thrombocytosis. It's called MDS, MPN, RST.
Yeah. Well, it sounds like this is possibly a hematologic malignancy. And there are many different kinds. You know, it sounds like it's a malignancy of the blood-forming cells, of the blood-forming and or immune cells of the body. So, no, I don't think, you know, when I began my journey as a young doctor, there was nothing. There was almost no data regarding anything about eating plants, how plants could help you. You know, today there is a lot. We have a lot of data and evidence that eating a diet of whole plant foods can reverse diabetes. They're landmark diseases. They're basically mostly metabolic diseases. They're cardiovascular diseases like heart attacks and strokes. However, the malignancies are not part of that group. Yes.
I looked it up in the medical literature just briefly, and it says the disease is an entity characterized by anemia, bone marrow dysplasia with ring sideroblasts and persistent thrombosis of greater than 450 times 10 something or other, with proliferation of large and morphologically atypical megakaryocytes. This is why
yeah, well, it's basically there are too many platelets. It's a bone marrow. It's a blood malignancy. The bone marrow is making too many platelets. The platelets are the blood fragments which clot our blood, and the megakaryocytes are the blood cells that in the bone marrow that make the platelets. So it's a blood malignancy. The sideroblasts, meaning there are rings of iron around them. So the bottom line is this is I can assure you this is not a common illness. And even for common malignancies like ALL, leukemias, and sort of like breast, well, not breast cancers, but pancreatic cancers, or some of the things you've heard of, we don't really have a lot of data on those showing that you could reverse them. Reverse, I'm not talking about prevent, reverse these diseases. So the data showing reversal of malignancies is very spare. However, I take my father as an example of somebody, he's not in a study, but I saw all the data with my own eyes and saw his CAT scan. I mean, that was a terrible cancer, pancreatic cancer, late stage. He was able to reverse it. He didn't get any other treatment. I know of, there are people with death-defying malignancies who are cured. I know them, I've seen them. Metastatic renal cell carcinoma, it's devastating. Your old friends at True North, Dr. Clapper and Dr. Goldhammer, they published a case in the British Medical Journal, one of the best medical journals in the world, describing a lady who had a lymphoma, which is sort of like a blood cell, immune cell bearing kind of malignancy. And she was cured. I just spoke to Dr. Goldhammer recently ago. She passed her 5th anniversary, which technically means she's cured. She didn't get any chemo. So there are these cases. Are they the same malignancy your mother has? No, they're not. However, I'm highly doubtful you'll be able to find evidence. It doesn't matter, just do it. And here's why you should do it. It'll be fantastic for her. It'll be the greatest thing since sliced bread. Can I say sliced bread?
Sure.
Okay. And the reason why is eating a diet of whole plant foods at a high level does a lot of things for cancer patients. It just doesn't, aside from whether it reverses the cancer or not, it'll do the following. These are the following benefits. I can absolutely tell you because I treat many cancer patients who come to me because they're desperate. They don't want to get conventional treatment. And then they do get conventional treatment. It absolutely enhances performance status of cancer patients. What's performance status? The performance status of a cancer patient is how well can a cancer patient stand up to how strong are they and how vital are they in the face of cancer treatments. Let's say you have to get an operation, or you have to get chemo, or you have to get radiation. If your performance status, if you're weak and fragile and frail and you're exhausted, you're not going to be able to accept any treatment well. I've universally noticed that it improves performance statuses of all cancer patients. What else? If you do happen to get some conventional treatment like chemo, absolutely, I've noticed that eating like this minimizes any side effects from the chemo. What happens if you have to get a surgery? It improves by light years your healing time from the surgery. What else can it do for you? Absolutely, the eating like this improves your immune system. And who doesn't want to get an improved immune system? You need your immune system to contain the cancer and help to fight it. Like, for example, eating like this, a whole food plant-based diet, is known to increase natural killer cells. Natural killer cells, their job is to go and kill cancer cells in your body. Who wouldn't want more of that? So I've just given you some reasons, despite, even if you can't find studies for the sideroblastic, the myelodysplastic, this malignancy that you have, it doesn't matter, do it. And it'll make you feel better. It'll make you feel better, do it.
Thanks, Dr. Weiss. So the next question is from Deborah. Do you recommend vitamins, and how do you know which brands to trust?
Oh, how many hours do we have left? Chef AJ? So, you know, I tell patients when they come in, I'm not a supplement person. It doesn't seem right to me, right? Because if Mother Nature and our creator, whoever that is, if they created us, and if we were living at the highest levels of lifestyle, we're eating everything we should, and we're getting all the elements of what we need to build ourselves from that. Like, why would we have to take pills from a factory? Does that make sense to you?
Well, nothing.
It doesn't go right.
Why would we have to ever have gastric bypass surgery? Like,
I understand. Well, but the question is, the problem is that, can you get to that optimal point? You know, it's the modern world, right? You don't spend your entire day, right, trying to figure out every molecule of everything you're getting. Who's growing your food? Who knows who's growing your food? What kind of soil did it grow in? I don't know. Did it have iodine in it? Who knows if it had iodine? Was it near the coast? Who knows? So because of that, when patients come here, we test them for some basic things to see if they're deficient. And if I find them deficient, I do give them those supplements. So what are those supplements? Obviously, one is B12, because if you're eating plants, you're at higher risk to get a B12 deficiency than a normal omnivorous person. Although I am seeing a lot of omnivorous people lately who have lower B12 levels. However, let's talk about the plant eaters. That's like a mandatory thing, because plants, because we've changed our food system. In the old days, our food used to be contaminated with bacteria that made B12, and now it's not anymore. And so our system is so sanitized, it's really hard for you to get B12. What happens if you have a B12 deficiency? It can cause devastating and permanent neurological damage. I have seen patients who were demented. I thought it was Alzheimer's. You can't tell the difference. And it turns out they didn't have Alzheimer's, they had B12 deficiency. And it's too late. Once you start taking the B12, if you have that, it doesn't help you. So you don't want something like that. It can also cause your peripheral nerve damage in your legs. I've seen people who couldn't walk anymore. Always take B12. That's a supplement you have to take. And I know there are calculations that say, oh, you could take like 5 or 6 or 7 micrograms a day, whatever. I find for my patients, 500 is a good dose a day for the average patient. And then I check it once a year and I make sure they're okay. That's what I do. Vitamin D. Vitamin D, I do check that too, and that's very controversial. There was a very large study just within the last year that was funded by the National Institute of Health that demonstrated that people who take vitamin D, it doesn't improve their rates of fracture as they get older. And you think to yourself, what? I mean, I'm taking all this vitamin D to build my bones and I still fall down and I get fractures in my bones as I get older. So what am I doing it for? Well, I don't know. It's not clear, but we know vitamin D is a really important vitamin, and you don't really get it from eating. You get it from going out in the sun because your skin makes it in response to exposure to ultraviolet light. We did not evolve to really be eating this vitamin, but because a lot of us spend a lot of time indoors, Chef AJ, like I'm here I'm on this beautiful farm, but I'm in this room seeing patients, and some days I don't get out with the sun. I take a vitamin D supplement because I don't want to become deficient, which could happen. I have been deficient in my life. So I recommend taking 2,000 a day. We know that vitamin D is a very important vitamin, and it has intimate relationships and connections with the control of your immune system, perhaps preventing malignancy. So we just want to get a person in the normal range. And then I check that once a year on the blood test. So we went over vitamin B12, vitamin D. Let's see what else. The other thing I've been checking in the past recent years is iodine. And the reason why I check that is because a lot of our patients, we tell them not to eat table salt anymore, right? Because it's SOS free. But guess what? For the average American, most of the iodine comes from table salt. And especially if we tell them not to eat fish anymore and seafood, which is what a plant-based whole foods diet is, then they're not getting iodine from that. Iodine comes from ocean. It's in the ocean, it's in the seawater, it permeates coastal soils. If it's in the soil, then your plants that you're growing in it get it, or if you eat fish or seaweed that comes from the sea, you can get it. If you're not eating these things, you can become iodine deficient. And guess what? When I started checking my patients, I found that about 20% of all of our patients have no detectable iodine level in their urine. It's 0. We couldn't find it. And iodine is an essential, guess what? There's only one tissue in your body that even uses iodine, and it's the thyroid. Your heart doesn't need it. Your muscles don't need it, nothing, brain doesn't need it, but your thyroid will go out of business if it doesn't have it. So that's why we check it. And then when I find this, I tell our patients to either eat 2 sheets of nori every day, 1 teaspoon of aramay flakes, or 1 teaspoon of dulse flakes. Those are all seaweeds. Or you can put a drop of iodine on your tongue. It's 150 micrograms every day, and that's it. So let's see, those 3. And then what we tend to do is, I also, because we're worried also about cognition, and especially as people get older, we want them to maintain executive cognitive functioning at a good level, and we want them to maintain memory. There is evidence, significant evidence, that shows that you want to have higher levels of long chain omega fats, 3s, in your bloodstream. And so we check that test. And if that's a whole big subject, suffice it to say that we encourage our people to eat ground flaxseed, 2 tablespoons a day, and then maybe extra chia seed, and maybe sometimes some walnuts, because those have very high levels of the starting material, the short chain 3s that your body, through a very rickety process, can turn into the long chains which your brain uses. It doesn't work out a lot of the time, because a lot of us are not good at doing that in our system. And so if that doesn't turn out, then we put them on a supplement. And that supplement is a DHA EPA supplement. We start them off at 250 milligrams a day, and then that universally gets their levels up. So those are the major ones. There is, let's see what else. Zinc is a potential maybe for supplementation. Sometimes you get a multivitamin, it's often in there. Zinc is maybe deficient in some of our plant-based diets because, it is in some foods like lentils and legumes and some whole grains, but there are phytates in these foods. Phytates bind up minerals like zinc and calcium. So even if you eat a lot of like red lentil soups or stews or things like this that have these foods, you may be ingesting a lot of zinc, but the question is, how much zinc are you actually absorbing from your GI tract? Nobody knows. And we don't have a test zinc levels. And that's why sometimes I think it may not be a bad idea to get zinc, some multivitamins, have them maybe, 10, 15 milligrams of it. And I think that's enough. I see no reason. A lot of people take calcium. I don't see the reason for doing that. And you can get enough in your food, in your whole plant foods. And some studies have shown that taking supplements of calcium are dangerous. They can increase your heart attack rate, especially in postmenopausal women. I see people coming in all the time taking all kinds of supplements, all kinds, like extracts of plants or whatever. The bottom line is all of these things, including the ones I recommend to the patient, there's no system to guarantee their validity. It's not like you're taking like a blood pressure pill. When you take that blood pressure pill, the FDA makes sure that there's quality control to make sure you're getting that blood pressure drug molecule. That's not so of supplements. In fact, the politicians have for years made sure that doesn't happen because because they're moneyed interest in that. So we don't have any reassurance that what you're taking, according to the label, is actually what's in the pill. And when they've actually studied the purity of these things, they can find everything from, let's say, none of the item you're trying to take, you're looking for in the supplement, to 50%, to 30%, to 90%, is rarely 100%. And sometimes, unfortunately, it comes with doses of cadmium, lead, and all kinds of other heavy metals, things that are just terrible contaminant. So that's why I'm not a big component of supplements. I'm sorry, I can't hear you.
Sorry, for some reason I got muted. I also, this is live, guys. I don't know why people are saying this is pre-recorded in the chat. Is this live? Hello, right now.
And I am alive.
I know.
I am alive, thanks to plants.
It's Friday, Friday the 17th of February at about 11:37 a.m. Pacific time. This is live. But anyway, is there a brand you like? Because I know that Dr. Goldhammer likes a brand called Pure Encapsulations that they sell at the True North Health Center.
Yeah. So what I would recommend is when you take the vitamins, find someone who's reputable, like Dr. Goldhammer or Dr. Furman. Find someone who, who you can trust and just go with it, unless you want to test them yourself. And then what I do is I get the blood test, because I can see, we can see whether these supplements actually have what they are in, have what they say on the label, because I will see the values going up uniformly. Once in a while, rarely, I see them not rising. And when I see that, I tell the patient to switch brands.
Perfect. Here's a question from a man named Danny, and it's about prostate health. I'm 66 years young and have been on a whole food plant-based SOS-free lifestyle for over 2 years now. I'd like to improve my prostate health with lifestyle. In 2021, my PSA was 0.48 ng per ml. In 2022, it's the same. I wake up 2 to 3 times a night to use the bathroom. I cut my liquid intake after dinner, which is around 5 p.m. I only take vitamin B12 and vitamin D. Are there any particular plants that would improve my prostate health, or are there prostate vitamins? And if there are, do they help any? I exercise 4 to 5 days a week.
Well, this young gentleman seems like he's on an excellent trajectory, and I congratulate him. And let's keep going. So here are some things I usually go through with men when they're urinating, at night excessively. I like to see a patient not getting up at night to urinate, or at the most maybe one time a night. And the reason why is because it's disruptive of your sleep architecture. When you keep popping up to urinate, your sleep is disturbed. And if your sleep is disturbed, then you don't have a restorative sleep. You cannot adequately restore all of the things that need to be repaired at night during your sleep.
Bless you.
So for that reason, I take these complaints seriously of waking up multiple times a night, and I try to act aggressively to address them in patients. What can we do with this young man? The first thing I try to do is some simple sleep hygiene. And this young gentleman said he eats at 5 o'clock, right? Dinner. That's a good start, but you also want to make sure you're not eating after that. Like some people have snacks or whatever, eat fruits at 8 o'clock or have a snack thereafter, or drink water after their dinner. I would stop all oral intake at nothing after 6 o'clock, because you have to remember, Chef AJ, when we eat, we're eating mostly water, because we're not eating chickens and kind of cheese like that. Our food, most of what we eat is like 90+% water. So no eating and no drinking after 6 p.m. That will give your kidneys time to clear out free water out of your blood, pee it out. Make sure you go to the bathroom before you go to sleep to empty your bladder. So there's no water in there. I would do that. What else can we do? Well, I'm suspecting that as men get older, generally speaking, a very common condition is enlargement of the prostate. And if it's a benign thing, it has nothing to do with prostate cancer. This young gentleman said he had a very low PSA. And by the way, just FYI, I don't recommend checking PSAs to our patients. unless there's a specific reason to do it. I don't do it for general cancer screening. And the reason why is because it's recommended against by the United States Preventive Services Task Force as a routine cancer screening. Because after they looked at all the data, it's thought that getting PSAs on otherwise healthy men who have no significant, very severe risks for getting prostate cancer cause more harm than good. So that's why I don't recommend them. And if this gentleman would like, you can go Google United States Preventive Services Task Force. They make that's the federal organization that makes all the recommendations for what we should do for looking for cancer tests. And you can read, it's fully explained about this. So especially if you're whole food plant-based, you have a very low risk of getting prostate cancer, lower than the average American. So if the USPSTF has made a recommendation not to get cancer prostate screening for the average American, you will be very harmed. You have much more of a risk of really getting harmed by getting this PSA test, because your chance of getting prostate cancer is extremely low. So getting back to the question. So the urination. So we talked about prostate cancer a little bit with this gentleman's PSA, which by the way is very, very low. It's like 0.4. It's almost nothing, zero. So you're not dealing with what seems to be a cancer problem. You're dealing with potentially an enlarged prostate problem. And so what I would do is if you try some simple things like these sleep strategies, cutting off water, and if that doesn't do it for you, also make sure that you're not drinking too much water overall during the day. Like I wouldn't probably drink more than, definitely under 64 ounces, maybe 48 ounces, because remember, a lot of the vegetables and fruits have water too. And definitely don't drink caffeine, because that's a diuretic. That makes you pee, and that caffeine can last in your body a long time. Make sure you don't do that. Those are sneaky causes of urinating at night. Even if you drink it in the morning or at like late morning, it could still cause problems. So get rid of that. And then if you're still peeing at night, I would have your doctor evaluate you to see if you have that enlarged prostate and to see if you're draining your bladder. If people with enlarged prostate, sometimes they cannot fully empty their bladder because the prostate sits underneath the bladder and the drain pipe runs through it, and the drain pipe is impinged upon. And then you'll go to the bathroom, but you just can't empty the bladder. There are other problems too, like overactive bladder, where the bladder goes into spasm, you have to pee, you pee a little bit and whatever, but then you would need bladder evaluations. Last, just some suggestions. There is some evidence that perhaps flax seeds, if you eat enough of them, that they could reverse benign prostatic hypertrophy symptoms. And we did have one patient who did get better. The amount of flaxseed you would have to eat is a lot. When I tried to look at the studies that were available, and it was sort of equaled like a quarter cup of ground flax seeds every day. And the active ingredient in that flaxseed is lignans, which have an amazingly beneficial effect on the prostate. And if you were going to do that, I would give it a trial for like 6 to 12 months. And the way I would do that is to eat 2 tablespoons ground, fresh, not cooked, and then eat the remaining 2 tablespoons in cooked in a muffin in a moist heat, or I like to put it in like 120-degree water, not too hot because you don't want to destroy the valuable omega-3s in there and oxidize them. But the moist heat helps to reduce naturally occurring high cyanide levels in flaxseed. They do come with cyanide, which is not such a good thing. And I don't think you'd really be getting into danger if you had even 4 tablespoons raw or 5 tablespoons. It probably comes out, I'm sorry, about to 5 tablespoons raw. It's not 4. That's a little bit more than a quarter cup. But just to be on the safe side, I tell that to the patient. So give that a try. But the first stop I would make is to your doctor and be assessed if the simple dietary things I told you with the water and the caffeine don't work out.
Thank you. Do you think the Zyda control sock could help? I know you probably don't have time to watch my show, but I had this Israeli inventor on Monday because I have overactive bladder, and it's a neuromodulation device, but instead of having to go to the doctor's office and get the needles in your ankle, it's percutaneous tibial nerve stimulation. You just wear this sock once a week and it's fun.
And did it work for you?
Yeah, it works great. I was already having neuromodulation done at the doctor's office, but it just the driving was killing me.
I know. Well, this is a self-administered thing, right?
Yeah, it's just I wear a sock once a week for a half hour, but we didn't happen to ask the inventor about the prostate.
I know, Israeli technology, right?
Yeah.
I mean, so look, that thing, so what Chef AJ is talking about is, and I mentioned that, you know, in the differential diagnosis of someone going to the bathroom too frequently is the bladder is a muscular tank. It's like a tank of water, right? It holds urine and its walls are thick muscles. And sometimes these muscles go into these uncontrolled spasms, and that makes you feel like you have to pee. And it can be very disruptive. And there's all kinds of ways to deal with it. There are drugs you can take. There's actually pelvic floor therapy, meditation, mindfulness. And by the way, I was speaking to Chef AJ. We're going to deal with mindfulness in our next episode next month, and how we utilize mindfulness to overcome medical issues. And this is one of the ways we can, using mindfulness-based stress reduction. But suffice it to say, there are ways. One of the ways, which is in more recent times, is this percutaneous tibial nerve stimulation. And it sounds like the craziest thing. Like, why would trying to stimulate a nerve in your shin have anything to do with your bladder? Nobody knows why. And quite frankly, I don't even know who is the genius who came across this.
Oh, he mentioned it on the show at Yale doctor. He did, but I can't.
Of the needle?
Yeah, the guy that invented it with the needle, he mentioned it on the show, and I'm sorry, I can't.
And did you remember how they thought of this? Because
no.
We don't even know that this nerve in your leg has nothing to do with your bladder. But so someone figured it out, and you have to go to the urologist's office like for 12 successive visits. They put a needle in your leg. It doesn't hurt or anything. My patients have had it done, and it is effective. I would say it's pretty good. The patients like it. And it does get rid of their problem. Why it works, nobody knows. But hey, if you could just wear a sock instead of going driving, as you said, to your urologist's office.
Yeah, that's really
up for that.
I know. It's the thing is, it is FDA approved. It's just insurance doesn't pay for it yet, and it's $750. When you think about the copay,
the plot thickens.
No, but Dr. Weiss, my copay was $80, so it's not free to go to the doctor.
Oh, okay. So it'll probably work out about the same. Actually, it'll be more expensive. Every time you go to the urologist, it's $80.
It's an $80 copay.
That's more than it's more than, you know, what is it? It's $1,000.
Yeah, exactly. So it ends
You're
up
saving money.
I'm saving money, but I'm also, you know, the driving and the traffic and the parking and the weather. I
you saved $100,000.
That's right. You're so great.
I'm sure it's.
You're awesome. Oh, we got so many questions. I just don't know which one to take. So let's take this one. It's about a disease that I've never heard of. Joanne says, Dr. Weiss, can anything be done to improve wet macular degeneration? Is there like a dry macular degeneration?
Yes, there are two types. There's wet and there's dry. The dry, macular degeneration is usually more stable and it's very much less likely to progress. The wet is aggressive. So remember earlier in the show, Chef AJ, we talked about the raw kale and the cooked kale?
Yeah.
And remember I told you there was a pigment? The world's leading source of lutein, which is the pigment that we think is in deficiency that causes macular degeneration, as well as zeaxanthin, which is another pigment. These both come from plants. So the raw kale has a good amount of it, but the cooked kale is the world's champion. So that's an example of a lady who should start eating cooked kale. So in any event, macular degeneration is the leading cause of permanent vision loss in senior citizens. Did you know that?
I did not.
Permanent cause of blindness in senior citizens over the age of 65. It's very serious. They've come up, and it's basically a deficiency, a lifelong deficiency of these vitamins. These they're pigments, they're plant colors. Your cells, the macula cells, which are these very, very, very sensitive cells, which are responsible for sharp vision, require these pigments in order to sustain themselves. And when you don't get them in your diet, or if you're smoking cigarettes, cigarette smoking is a big contributor to risk for macular degeneration, like more than double your chance of getting macular degeneration. So stop smoking. You're at risk for getting this. What can you do once you have it? Make sure you eat a diet of whole plant foods with very large amounts of zeaxanthin and lutein. Zeaxanthin, XEA, Zea, that's the genus, I'm a botanist, right? For corn. Yellow corn has zeaxanthin. That's a leading, eat corn, yellow corn, cornmeal. These are, the lutein, goji berries. These things have huge amounts of these pigments. Eat them every day. The ophthalmologist will probably tell you to take vitamins. That, again, we're talking about supplements, right? That have these things in them. I guess so if you want to, but quite frankly, I believe you can do the best eating these things in whole plant foods. These days also now they have Avastin. They have these drugs that they inject, the needles in your eye. And if the wet macular degeneration, they usually go over that one with these injections to try and stop it. That may be something your ophthalmologist may want to consider because, you don't want to lose your vision from macular degeneration. But definitely eat the whole plant foods. Definitely eat them.
Yeah, I'm glad you mentioned smoking. We always think that, vegans don't smoke, but, sometimes they do. And you wonder, like, if somebody smokes, it's very hard to quit. But who are these new smokers? Like, who is actually starting? Because blows my mind that people like start now, not back in the day when we didn't know.
Yeah, I would say, I know over my lifetime. So I was born in 1962. And that was just before just at the threshold of when the vital evidence was shown that smoking causes lung cancer. And it was first demonstrated by one of my professors at Rutgers, New Jersey Medical School, Dr. Oscar Auerbach. He showed that dogs, unfortunately, who smoke cigarettes get lung cancer. It was a Veterans Administration study. It was done by the VA in East Orange, New Jersey. And because of his work, that was a foundational thing which made the Surgeon General finally say, we're putting these warnings on cigarettes. Since then, Chef AJ, smoking has been cut in half, more than in half in America in my lifetime. When I was born, about half of all Americans smoked cigarettes. Now I think it's like 22%, 21%, or 20%. So we've made great achievements. We just have to keep going. And young people, especially young people, it's, don't start smoking. Don't smoke. Young people, young people, because I have a, 15 and 17-year-old, they're invincible because they're immortal. But, and they don't understand that doing these little things when can lead down the road to bigger things that are difficult to escape when you're older, but don't start when you're young.
I mean, now we got to worry about even more serious things than cigarettes, like kids taking fentanyl,
Yes. Yeah.
Man, and I thought the world was scary when I was little.
Yeah.
Oh, you're so easy to talk to. I wish,
Thank you. You're the easy talker, not me. I'm just following your lead.
Yeah.
I'm sorry, but I see that I probably have the next patient up. So I just wanted to, say thank you so much again, and wanted to tell the audience, whoever's listening, next month we're going to have a really special session with Chef AJ, because we're going to really, I believe we may be one of the only practices here on the farm who really utilizes at the core of lifestyle medicine mindfulness to really as a tool to address health issues and to prevent them and to reverse them. And I think that's why we get such good results. And we take the mindfulness comes in through our medical office from the fields and the forest and the crops, because our farmers are so mindful. That's a much bigger palette that they're dealing with. I'm just in a room dealing with one biological system in a human being. They're dealing with infinite biological systems from everything, insects and all these organisms and plants and soil microbes. And so they have to be really mindful, and that's inspired me. And so we're going to talk about how we apply mindfulness and how you can too to overcome your issues. So please come next month. We're going to have as my special guest, we'll chat with Asha Gala, who is certified in mindfulness-based stress reduction, and she's our lifestyle clinical director here. And once again, I just wanted to remind everyone, please save the date for Farm Days, September 9th and 10th. It's going to be a blowout here in New Jersey. If you've never been on a vacation in New Jersey, it's the best in the world. It is. Oh my God. It's my favorite beach in the world, and I've been everywhere. It's just great. Spend a week in New Jersey and end it at our Farm Days. And maybe you may find yourself wandering into New York City. We're about an hour west of there.
Wow, fantastic. Well, do you have time for a really, really quick one about somebody? Okay, This is just because I think this will be a quick one. Denise wants to know if she should use Canestin, an antifungal cream, because she lost a significant amount of weight eating this way, but she has some redness in the folds of some of her excess skin.
So what is the drug?
Canestin. She says it's an antifungal for yeast infections.
How do you spell that, please?
C-A-N-E, like cane, sten, S-T-E-N.
I'm sorry, C-A-N?
E-S-T-E-N, cane sten. I don't know, look it up.
C-A-N-E-S-T?
Yeah. C-A-N-E-S-T-E-N.
I'm sorry, because the resolution on the audio is like
it's an antifungal cream. C-A-N-E-S-T-E-N. Cane sten. It's clomitrimazole. I think.
Oh yeah. See, the reason why it's clotrimazole. The problem is that you want the clotrimazole is the generic chemical name, and that's what doctors know. And sometimes the company can pop up and just call it whatever they want. So this is clotrimazole. It's like a Lotrimin. It's over the counter, So if it is indeed a fungal rash, then yes. I think that it can't hurt. You can get this over the counter. Lotrimin AF antifungal is that. So put it on for 3 weeks, twice a day. And if it goes away, then you were right. And if it doesn't, you were wrong. And go to see your doctor.
You're great. Thanks so much, Dr. Weiss. I can't wait to have you back.
Chef AJ.
Take care.
See you soon.
Thank you. And thanks all of you for watching another episode of Chef AJ Live. Please come back at 2 p.m. Pacific time today when my guest is Dr. Paulie Joseph from the NIH. That's the National Institute of Health. She's one of the experts on the upcoming Truth About Weight Loss Summit starting tomorrow. And she's going to talk about how COVID-19 can impact the sense of taste and smell and what the implications for nutrition are. We don't get a lot of people from the NIH because they're not always allowed to do stuff. So